It's been a press briefing at the Brule Suite today talking about safety for patients, and we've got other items on MTTV about that, but I've got the Minister with me today. Do you want to say anything about that side of things first of all, because you've done a briefing to other members. Safety in hospital, I mean this is going to be a safety week, hospital week, isn't it, for you?
Well, patient safety is an ongoing issue at the hospital, and I think that's what we're emphasising today. It's not something that we've just dreamt about, it's something that's been on the political agenda, not just on the Isle of Man, but in the UK very much in the last several months.
But surely this is all about what's going on at Nobles today, at the moment, and the health system.
It sets the scene for people, what's happened in the past, what systems we've got in place, and more importantly, what we're doing to make sure our systems are robust for the future. So it's not a standalone situation. You have to, patient safety is something that has to develop all the time, because we have to be cognizant of all the medical changes that are taking place and make sure people's patient journey to the hospital is as safe as it possibly can be.
And people are worried at the minute, but I mean, was the event today just purely randomly about safety, or was this because of what's going on about your situation as Minister?
I thought it was important, and the department thought it was important, over the last several months, where there's been several issues to do with patient safety, that people understood what we do in Nobles Hospital, why we do it, and how we update it on a regular basis. And I think Steve highlighted to you the different work streams that we've got to improve patient safety. Some of it might be resource intensive, and in that case we'll have to make a business case. We'll have to go to Treasury, to Council of Ministers, to get the extra headcount in various issues. We've been fortunate that we've had the Chief Minister around the Nobles Hospital several times this summer, and so he's got a better understanding. He hasn't been in the health scene before as a member, so hopefully it's give him a better understanding of the challenges we're facing and the ways possibly of heading off those challenges.
Well, I mean, there's always concern about health. How did it go with the members' briefing? Did you have a full house? Was everyone here? And I know not everyone's taken up the option of walking around the hospital, which you've offered them.
Not yet. No, we had a reasonable turnout. We got to, we're only on the 1st of October. Some people aren't available yet. Some people have had other commitments. So it was a decent turnout, but not as many as we'd hoped. But we will be circulating the information we gave to members, to the members that were absent today, to make sure they're as much in the loop as possible.
And were those 10 who are aiming to put a motion of no confidence to you, were they present today?
Off the 9 that signed the letter to the Chief Minister, do you mean?
Yes, okay, 9 then.
I think there were 4 of those there today.
And anything they had to say particularly? I mean, these guys are in here to try and get you out of your job, aren't they?
This was a presentation on patient safety at Nobles Hospital, and we tried to keep to that specific subject today. And so some of them had questions about patient safety, and they got answers. Some of the answers they got, maybe they weren't totally satisfied with, but they heard it how it is.
Now, I understand it, as we taping this, but I understand that the motion is there. There's a question in Tynwald asking for your resignation as such. I haven't seen the wording. No one knows exactly what's going on there.
I haven't seen the wording either, so I'm, we're grasping the dark. No. Obviously, it's not something I relish, but we'll deal with it when we come to it.
I mean, do you want to fight your corner? Do you want to continue? Are you happy to stand aside? What?
No, I'm happy to continue. I've got faith in the team that's behind me to deliver the challenges we've got ahead in the health service.